Stroke, severe head injury, automobile accident. What does standard medicine do? Nothing. You go into the hospital and you lay there for a week. They do try to drop the blood pressure. They do want you to get off of smoking and diabetes, obesity, get off the oral contraceptives that they know cause blood vessel clots. You get you on aspirin, hospitalized for bed rest, control of blood pressure. If there's seizures, if there's fevers, all they're going to do is sit you in a hospital bed and try to keep those factors under control. They're going to put you on heparin, agents that will break down the blood clots. I was fascinated with this quote that is in the standard medicine textbook for strokes. There are no proven therapies for acute ischemic stroke. There is no treatment in standard medicine for a stroke victim. They put them on rehabilitation because there's a stroke, so one side of the body is affected, and so they rehabilitate. What do? We obviously want to reduce the risk factors, the same as standard medicine does. Hyperbaric oxygen, if we could get those people in our hyperbaric chamber within 6 hours, we could almost guarantee no residual effects. Because the problem with stroke, the problem with head trauma, the problem with that accident in the automobile accident is swelling. There's blood vessels breaking, there is a bruise to the brain, blood vessels are broken, release the tissue, release the plasma into the tissue, just like when we bump it here, we get it swollen in the brain. That causes constriction of the blood vessels, so it can't get to that point. Tissue dies, and now we have the residual effects of the stroke. Hyperbaric oxygen can reverse that. The other problem with a stroke is there's a lot of free radical damage that takes place. The free radical damage causes more swelling. More swelling causes more loss of blood supply to the area so that healing can take place. Less oxygen to the area causes more free radicals, causes more swelling, causes a whole cycle of events. DMSO is a free radical scavenger. We will alternate the DMSO IV so we know it gets into the bloodstream with hyperbaric oxygen. In that combination, we can almost guarantee very little to no residual with a very serious injury. Acupuncture, Jinshin-Jyutsu, craniosacral, this is just getting energy flow through damaged tissue. We use nattokinase, we've already talked about it. Garlic is an inhibitor of platelet aggregation. We don't want more clotting, so garlic. Pancreatic enzymes taken between meals. Just like the fibrinolytic enzymes that standard medicine is using, we are using pancreatic enzymes, high doses between meals. If it's used with meals, then of course it breaks the food down, it doesn't get absorbed. Between meals, there's no food to break down, the enzymes get absorbed into the bloodstream takes it to that area of clot. We can now start breaking some of that clot down or stopping the increased production of the clot. Rehabilitation if needed.